Councilmember Gutierrez, you have a little bit of the backstory there, so welcome. So we do have a quorum, so we'll go ahead and get started and we'll
I just realized, yeah.
and we'll call to order our January meeting of the Mason County Board of Health. And we'll just do a quick round of introductions around the table. I'll start. Kevin Schutte, County Commissioner and Board Chair.
Peggy Van Busker from Hospital District 2.
Sharon Gass, County Commissioner, District 3.
Randy Nevlin, County Commission, District 1.
Miguel Gutierrez, City Council Member, seat number 7.
Dave Wyndham, Director.
Ian Tracy, Environmental Health Manager.
Christina Miller-Shin, Mason County Public Health and Human Services, Program Specialist.
Melissa Casey, Community Health Manager.
Rachel Hook, Mason County Public Health WIC.
Oh, consistent citizen, and Louis.
And Louis.
Very good. We do have a couple of amendments to make to our agenda today based on some late breaking news. Dave?
Right, so we got three things. One is chair positions. We need to look at chair positions and decide if we're going to add new chair and vice chair. So that's an action item. We have two other action items, and I will pass these around so you have a chance to look at them. At the first meeting, business meeting of the year, we are supposed to pick alternate health officers in case our health officer is out. And we have two things going here. So we've got State Department of Health through their regional medical officer has offered to fill in as health officer should we need them. And then we have used in the past Alan Melnick from Clark County as well. So my thought was we put both of these things on and probably approve both of them. The one from the state, they're not going to charge us for their services, and Alan hasn't charged us for his services either.
So I only have one here.
And
Yeah, so there's a three, it's
But-
3 pages.
Yeah.
Actually, I don't have Alan's on here. Alan's, we just did by voice in the past, so.
So Dave, we can, with the recommendation be to slot election of chair and vice chair in between approval of minutes and the health officer report.
Yep.
Would you like all three placed in?
Yeah, I
this?
would just put all three of those in there.
Okay.
Get the action items out of the way.
Okay, so then it's DOH contract and how do you want the other one titled?
Just, it's authority to use Clark County as backup health officer.
Okay.
I think we even have a stamp too, don't we?
For a health officer?
Yeah,
Yes.
I mean, so we even have a stamp, so,
Oh, you said that's Clark.
yeah, Clark, Alan, yeah.
Okay. Okay, board members, are there any questions on amending the agenda or a motion to amend it?
Mr. Chair, I move that we amend the agenda to replace, let's see, after number 3, to place in the election of the chair, the election of the vice chair, then the entering into of the, what is it, DOH contract? DOH contract, and then another agenda item to allow the authority for Clark County to sit as our county health officer when needed.
I'll second.
Okay, it's been moved and seconded to amend the agenda with the addition of the election of chair and vice chair, contracting with the State Department of Health, and having backup health officer with Clark County. Any discussion? Okay, hearing none, I'll call for the vote. All in favor say aye.
Aye.
All opposed, and the motion carries. Next up, we have approval of minutes. We have minutes from both the September and November meetings of 2023, and if there are no changes, I'd entertain a motion.
So moved. I'll second that.
Moved and seconded to approve the minutes from September 26th and November 28th, 2023's minutes. Any discussion, commissioners or board members? Okay, hearing none, I'll call for the vote. All in favor say aye.
Aye.
All opposed. Motion carries. Next up, we'll have our we'll start with the election of board chair for 2024. And I would nominate Commissioner Netherland to serve as chair.
We're waiting for your person to come in.
And
Yeah.
It automatically left, right?
I'll second that.
I don't know.
Are there any other nominations for chair? Okay, hearing none, I'll call for the vote. All in favor say aye.
Aye.
All opposed? Motion carries. Congratulations, Mr. Chair. Would you like to conduct the vice chair?
Next up, we have nominations for vice chair. Do I hear any nominations for vice chair?
I would like to nominate Carrie. Can we nominate somebody that's not?
I have no idea what we're talking
She's not
about.
here.
I don't know,
But,
but you don't have to be vice chair often. We could nominate her and she could say no next time.
there's no rule that says we can't,
I
so
was,
I do hear a nomination on the floor. I'll accept it. Is there a second?
I'll second that.
Okay, we have a nomination for Carrie as vice chair and a second. Are there any other nominations for vice chair? Are there any other nominations for vice chair? Are there any other? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? The motion carries. She's gonna be surprised.
You know, you just don't miss anything.
Hopefully she sticks around.
Yeah, maybe we should have done that for chair. But then who would run the meeting today, so, okay.
The vice chair, which would have been you.
Yeah. Okay, with all that, we're gonna go ahead and move on to the DOH contract. You wanna do a briefing on it real quick?
Sure, so, back in October, hello, I'm just gonna put you here on speakerphone. I don't know why you're not even showing up as being on Zoom.
It's saying that the meeting hasn't started. Why don't you move forward with the meeting and let me look for another link?
Yeah, go to the county website and front page of that, it'll have a link.
You know, I'm on the county website and I can't find the link anywhere. All I can see is the commissioner meeting schedule. They don't have any other links. Under
It's
Board of
on
Public
the
Health, it
main
says that it's.
Okay,
Below
I'm gonna hand
is
your phone over to
below.
Mackenzie and we'll keep going. Hold on. Okay, so back in December, had a discussion with Scott Lindquist, who is the state epidemiologist. And he's in charge of the regional medical officers. There are 4 of them across the state, and that's a new position.
Right below that, under Jamie.
And we worked through this agreement for our regional medical officer, and ours is Herbie, right?
That name sounds familiar.
Yeah, so first name's Herbie. That they would be willing to fill in for us at times when we didn't have a health officer. And we went through a lot of discussion about the authority that they may or may not have, and got through the RCWs on that. The last question being insurance, and I think we have that all wickered out. Tim's looked at this, says he's okay with it. Basically, they're not going to charge us for services because they're already being paid by DOH. So this will give us a backup if we need a health officer. And there's Carrie.
You want her to speak now on any of this, or?
Dr. Gardner, we're talking about the contract with DOH Regional Medical Officer for backup health officer.
Did you have any comment on it you'd like to add?
No, thank you. I think it's a good system so that if somebody were to go on vacation or be unavailable. So I think it's worthwhile to join that provision.
Thank you. Does anybody have any questions for staff regarding this? Then I will entertain a motion if somebody's ready to make one.
Mr. Chair, I move approval of the interlocal with the State Department of Health for health officer.
I'll second that.
It's been moved and seconded for the approval of the interlocal agreement with the state of Washington regarding the health officer to be used when needed. Any further discussion? Hearing none, all will signify by saying aye.
Aye.
Any opposed? The motion carries. Next up, we're gonna go ahead and move right into the conversation regarding, was it Clark County?
Clark County, yep.
And Clark County and the opportunity to perhaps use theirs as another backup.
Right, so Dr. Alan Melnick has filled in for us in the past. We actually do have his stamp. He has done things for us on minute's notice when we needed to, for example, ship a body out of the United States. So he's been able to step in, take care of things for us. That's been a good relationship, and I just want to throw that back out here. It's worked in the past. I'd like to see it go forward as another alternative.
So you're asking for a motion for the approval to use Clark County as another alternative for the health officer when needed. Is that correct?
So moved.
Right.
Okay.
Second.
It's been moved and seconded to appoint Clark County as our health officer when needed as an alternative. Any further discussions? Hearing none, signify by saying aye.
Aye.
Any opposed? The motion carries. Next up, item number 4 is health officer report.
Good
Minutes.
afternoon, nice to see everybody.
We didn't.
Thank you
Yeah,
for
we
letting
did,
me
yeah.
join by Zoom. The first item that I wanted to report was the syndemic grant that we applied for and received from the state of Washington. And the funding will be coming through, Dave, I think in June, is that right?
Yeah, so actually, yes. So the grant starts now, and there's 2 pieces to it, and it goes through this time next year, and so 186,000,
185.
185.
So it's a good chunk of money, something that we were really hoping to use as really seed money to start some programs that Dave and I have been working on really for the last couple of years. The first is provision of clinical services. So Dave had taken the county out of the provision of clinical services some years ago, but there are some real gaps in our county for the provision of those health services. One of the glaring ones is hepatitis C, and you've heard me speak about this many times. So we have decided to use a good portion of this money to jump back into the arena of clinical service provision. And what that will look like is purchasing a van or some other vehicle that we can use so that we can deliver services to people who may not otherwise be able to come to a brick and mortar building, and hire an APRN and have either an RN or our APRN deliver those clinical services under my guidance and supervision so that we can provide services like treatment of hepatitis C. We don't have a firmly detailed plan because it's going to depend on the skill set of the person that we hire. But we have the money to achieve this goal, and we think that it's a real need for our county. I want to pause here and see if the Board of Health has any questions about this.
Anybody have any questions? Nope.
Thank you. The second piece of news that I wanted to deliver is that I took a new job a couple of months ago in my home state of Utah working at a free clinic. And I've become the chief medical officer, and it's been a real struggle to try to balance the needs of Mason County and my job here. So we are going to search for a new health officer to take my role, and I am wanting to do a warm handoff so that the work that Dave and I have done in the last 2 years does not go by the wayside. So you will have to suffer with me until we find somebody else, but I'm hoping that we can find somebody else to be Dave's right-hand man or woman to carry forward these services.
Actually, that's appreciative that you stick around in order to do that. Does anybody have any questions regarding this?
Comment.
Please.
Yeah, well, it's been very nice having you with us, Carrie, and I've appreciated your friendship and your knowledge.
Thank you, Sharon. It's so uncomfortable for me to say this that I forgot what I really wanted to say, which was it has been a real pleasure working with the commissioners, the Board of Health, and the entire staff of the Public Health Department. I have learned a lot. I felt like the county is very invested in serving people and taking care of our community, and I feel like we have a wonderful, lovely community that is worth taking care of course.
Couldn't agree more.
Thank you. And then the last piece is just about our communicable diseases. So things are popping up across the country at all times. There is actually a mumps outbreak in Philadelphia, so we're watching for travelers from there. We are constantly screening for tuberculosis. We have not had any new cases of tuberculosis, but we're still finding high rates of latent tuberculosis. No other new worrisome diseases, and COVID, which had a spike in late December, early January, as you may have all noticed, is tapering off again right now in our wastewater sampling. But influenza A and B are both circulating widely, and the vaccine this year is effective. Again, the strains that we're seeing in the isolates of people who are infected are the same strains that we are vaccinating for. So we're still encouraging people to get their flu vaccines because A and B are still going around out there. That concludes my report. Thank you, Commissioner.
Any questions or comments further? I'd like to thank you also. You've been a very much a pleasure to work with. Came in at a very interesting time again. It seems like good people step up just when we need them. So, and appreciate you sticking around long enough also to help us to have that soft handoff. It's very much appreciated. And just know around this table, we all appreciate you and are thankful you came when you did.
It's very kind of you. Thank you, Andy.
So next up would be our administration report.
Okay, so the primary focus today is just the year-end financials, which were sent out. If you need a copy, I've got more copies here. Oh, we've got those. We're in good shape. I like being able to say that. I came through the years when we were not in good shape. Commissioner, need that one. I remember my first year as a director of public health, I wound up laying off half the staff. This is not that case. It's nice to be on the other side of that coin. Cash flow, as you can see, we're pretty typical. In August, we had a large bump of revenue, and that reflected the latest influx of the new FPHS money, which we just got from the legislature in the spring, was authorized, finally arrived in August, and that's where you see that big bump there. End of the year, we had money that we sent back, and that's because we were using COVID dollars for a lot of the year and have spent through those dollars, and now this year we'll be spending more of the FPHS funds. So cash flow looked good, nothing out of whack. Fund balance over time. On page 2, you'll see we had a pretty high fund balance, and then in the spring, the treasurer took out money for investments and brought that back down, but then we had another batch of funds come in, so we're back up again on our fund balance. Revenue by source is interesting. It shows state funding 32%, federal dollars 32%, investments 1%. The opioid settlement is 9%, which we've not touched yet. Transfer for mental health we did not do this year. It can be as much as $200,000, but we did not pull that in this year. County contributions is 8%. Fees and permits combined for about 22%, and that's typically through environmental health. Budget versus received. So we're conservative on budgeting incoming revenue, and we received more revenue than we had anticipated, so that'll look good. Revenue by month, you see our high revenue months was when FPHS came in. So, and typically that's January, which is an automatic payment, and then the contracts are renewed typically the first week of July, but it seems like DOH takes their own sweet time getting those contracts out to us. And then it has to go through our legislative process. So last year we didn't get those funds until I think October. So getting them in August this year was a boon. And you see the negative in December, and that reflects money we sent back to DOH. So this year what we're doing is we're doing projections on monies that we may send back earlier so they can be redistributed to other districts. So, and that's mutual agreement between local health jurisdictions, LHJs, Department of Health, and the State Board of Health. So we all share those funds. And the way the legislation is written is we all have to agree on the disbursement of those funds, or nobody gets funding. So it's forced public health to work with DOH in a way that they hadn't in the past. So
That benefited us in the past though, when you went and asked for money.
yeah.
So I guess that's why you're so eager to go ahead and let it go early, so that they'll again if needed.
Right. And it's nice to have a seat at the table when these decisions are being made, and I'm on the board of ELK, which is the Executive Leadership Committee, and we have a big voice in how those funds are allocated by jurisdiction, who gets how much. So that's important. Budgeted expense, you see we came in, our expended funds were less than what we budgeted, always a good thing. So positive there. Expense by major type, just so we know, salaries and wages are our largest at 41%, benefits at 18%, services, and that's all kinds of services from health officer to outgoing contracts, those sorts of things, and that's at 35 or 33%. Internal charges at 5%. On the last chart on page 5, I broke spending out by spending per person per fund type, so across the county. So if you took our whole county population and you look at, for example, state funding is $33 per person per year. Federal dollars, $21 per person per year. Clean Water District and opioid settlement and those, and that's, again, that's per person per year. This is a big change over years past when we would get federal money, and you would get federal money coming in at like $56 per person per state, and what actually went out to the LHJs was about $6. So the state's doing a better job of funneling those funds out from, when they come in from the feds, out to us. So it puts us in a much better position in the locals. And then last was budgeted versus actual expense. And again, our actual expense is coming in lower than our budgeted amounts. So we're looking good in all those aspects of finance. It's been a good year.
So do you have plans for the opioid settlement, or?
We are working on that, and we're not the only ones that are kind of struggling with that a little bit. All the counties are, very few have spent any of the money. It took us 2 years to get enough to have in a pot to be able to do anything with. So we've got $218,000 in the account now. So it's time, and Commissioner Schutte and I have been getting together, and we're getting the band together with North Mason, Bo and Abe, Christina, and others to look at what we can do in prevention using those opioid dollars. So
I'm hoping that we can maybe roll some of it into our clinical services program, our harm reduction and substance use programs.
Do you see some of that in-home health stuff they're doing as part of the prevention program?
probably not for opioid.
Because I do know that by them handling the prescriptions and stuff, that actually could be a nexus though.
Yeah, this is a little more prescriptive than that.
Okay.
Yeah.
Yeah, I mean, it's probably worth a discussion just
Yeah.
to kind of see what, and then the opioid stakeholder group too is probably gonna have some suggestions and
Yeah.
ideas to bring forward, so. We'll see, and then just for everybody, in case they don't remember, the city has signed an interlocal agreement with us to send us your settlement dollars as well, because we were both entitled, and the city's portion was pretty low.
Like
and so,
17,000 or something like that, yeah.
So, we're happy to collaborate with the city on those things too. A lot of the services happen here anyway, so.
Good deal. Anybody have any other questions on this and that part of the presentation? You want to do this other part, or you have somebody else?
It's already in there. It's just kind of a tracking of flu. We are in a typical flu year, which for the past couple of years, we were not in typical flu years. In fact, in 2020, we didn't have a flu season. It just didn't show up. Everybody was so sick from COVID that.
They were all wearing masks.
And they're all wearing masks and washing their hands 20 times a day. So 2020, we just didn't have a flu season. It was the year without flu. We're back to it, and they're projecting around 150 deaths from flu across the state. It's kind of an average. So we're looking at an average flu season this year. Nothing in the epidemic status. So I think we're on a downturn now. So once you get past the second week of January, the flu tends to run down. Although what will happen is A will switch with B. So.
Well, and we really didn't, while everybody was masked up, we didn't have the RSV problem either.
Right.
So
And
but
this year-
afterwards, it hit everybody hard.
Right, and this year we have kind of the trifecta. You've got RSV, you've got flu, and COVID. And at the same time that the testing supplies are dwindling. So after the 31st of this month, we won't be able to order any more tests from the state. And there's no money to purchase them. So what we've got is what we've got. So it'll be out in the marketplace.
Yeah.
So that is a change in things.
Do you see a grant or anything coming for that in the near future, or is anybody working on that?
I don't know unless the feds spin something up.
And the feds haven't.
Yeah, I'm not even hearing
indicated
whispers.
that. Yeah.
So, and frankly, we haven't had a lot of call for vaccinations. That has dropped way off too, so. And DOH is tracking it in, differently than they did in the past. We had a COVID dashboard, and it was COVID. Now we have an influenza-like illness dashboard. So you get all three, flu, RSV, COVID, same page, and you're able to sort the data. People go to the website and sort it out however they want to sort it out, you know. Do you want to look at how many hospitalizations there were? Do you want to look at how many, you know, deaths there were? You can sort out that data, and
Even
that
the
makes
questions
it
I
easy.
get, I think they're down to maybe one a month. Where I'll get an email for somebody where it used to be, remember when it was happening, we were getting 30 a day.
Yeah,
So,
yeah, it's, and, you know, we've had some instances where somebody at the courthouse in a trial was, you know, tested positive for COVID. What do we do? Well, things really haven't changed in our protocols. So basically, if you test positive and you're symptomatic, you stay home for 5 days. Symptoms improve. And sometimes symptoms don't improve in 5 days, but you want to be without a fever for 24 hours with no Tylenol and before you come back. And when you come back to work, wear a mask for 5 days.
I would say they're all working that, I do chemo every Monday, as everybody knows. You can tell when it hits the building, because when it hits the building, everybody's masked up everywhere you see again for a while. Because sometimes they're still coming back to work, they almost have to, it's weird, we just learned to live within it.
It's,
What I always feel sorry for, I don't wanna say sorry for, whenever I go up to get medicine, I always think about the people that are in line in front of me, and I'm watching them, I just will see like you, and you smile and you deal with it, when I'm thinking to myself, you know, you've gotta be thinking it's coming to you, because they just don't have a filter, they just, so, I feel for you every time I walk up there and see that, you see somebody really bad.
Like I said earlier, I haven't been sick for a long time.
Yeah.
I think I get a little dose every day.
Yeah, actually, something to that.
yep.
Anything further on his report? Okay, hearing none, we will move on to the next one, environmental health. Ian?
Thank you. Good evening. I apologize for not having a report. I missed the deadline. I was out sick last week. I do have a kind of just ad hoc report for you. So one of the things we've been working on was Inspect-A-Go, which is our fully online electronic food inspection program. We had hoped to implement that starting January 1, but we had to push it back for various reasons, you know, staff illness and delays from the company themselves. But we are beta testing the inspection program right now, doing actual inspections with it before it goes live, and it's kind of locked in. So we're close on that. We think probably end of February, beginning of March, will be fully implemented and using the new Inspect-A-Go program. We are exploring rabies vaccination clinics, and this is an idea we had. It's just something that we're exploring and kind of scoping out as far as available funding for it, but it would be a certain number of times a year, you know, 1, 2, we have to see what the funding is like, free rabies clinics for residents to come and get their pets vaccinated. And we're in the thick of license renewals for pools, food establishments, and our on-site septic contractors right now. So we're staying pretty busy with that, and we're doing our annual reports. And we finally received the contract from Pierce County for water quality. This is the South Sound grant, and we're receiving $233,000 from whenever it's approved by the commissioners through August of 2026, and 40,000 of that is a scoping and possible permit application to do replacement of grinder stations in the Annis Bay area. So there are some grinders that are just the old septic tank that was there and they threw a pump in it. Those are the bad grinders. And then they have dry grinders, which are this fully self-contained grinder station. So we want to replace those wet grinders. So the money is to assess how much it would cost to replace all of the wet grinders, and also potentially pay for permits to do that work.
Are you thinking about making it mandatory on them to do it and them have to pay for that cost? Are you looking to get grants in order to?
This would be all grant funded if we got it done. The interesting thing with the grinders in Annis Bay is that's all Public Works infrastructure. Public Works owns everything about that system. Most systems, you know, the homeowner will own the grinder, and then Public Works will be responsible for like the property line to the main. Annis Bay was done weird, so when something
Okay, I
fails.
was gonna say the
This
same
is,
thing.
this is just what I've been told by Public Works, that when something fails, when a grinder fails, when a line bursts or something like that, Public Works is going out there and fixing that on those properties.
Go ahead, Kevin.
I was just, I think I'd be interested in getting some more information on the Public Works relationship out there. I wasn't aware that we were providing
We're not.
maintenance or we were doing work like that, so that's
Yeah.
news to me.
The
Yeah.
thing that you're talking about is that I know of is how we handle it on our system. Annis Bay is not our system. That's a privately owned system out there.
Public Works has told me that they own and maintain it, and I met with their staff out there, they did a GIS project on that system. Oh wait, no, I'm sorry, did I say Annis Bay?
Yeah.
I'm sorry, North Bay.
Oh,
I'm just-
okay.
Yeah, I'm sorry.
I'm like,
Sorry, totally screwed that up.
okay,
Yeah, sorry.
no, it makes all the
North Bay.
pieces come
It's
back
North
together
Bay,
again,
not
okay.
West Bay. Yeah, no, I apologize. Just, okay, with
And
North
I do
Bay-
know that we have some of those out there. They've actually been pretty bad. We had one right there right on the water at the restaurant.
Yeah,
Yeah, and literally that one's failed several times over the years, and we've done things to try and help them to get through that, but there's been a few times where it was really bad failures.
yeah, these grinders are mostly up on the North Bay Road section, is where they're located, these wet grinders. There was a few that are south of that fork, but most of them are north of.
Yeah, I'm sure if we were able to help them completely get rid of it, but no, that one at the, what's it called now, the boat shed was very active, and it failed over and over again. When I was first elected, it was a big issue, because it was one of those wet ones, and they let them grandfather it in by putting it in the one they already had that existed, and just wasn't working. The things were getting, especially with grease, it just wasn't
Yeah.
working.
Yeah, I can't handle it. But so that's a really good part of the contract, and then the remainder of the money is for pollution identification and correction work. And we hope to be able to hire a probably 2-year temporary water quality specialist to work that grant. And then the other thing that I gave everyone is a copy of a draft regulation. This is the drinking water code, and this is spurred by a couple of things. One part of this regulation is the RIA requirements, also called like the Hearst response. That part of the regulation is actually a Growth Management Act regulation. And so Pell is taking over that regulation, moving it into Title 17, from Title 6. And so that's one portion that's being pulled out of this regulation. And then the remainder is a bunch of, really, it looks like a lot of red, but it's really a lot of small changes, like updating language in this regulation. The most significant things that we're updating are the minimum amount of water that's required for a home. If someone applies for a building permit and we say you have to have X number of gallons available, our previous requirement was 800 gallons per day for that house, which is a enormous amount of water, and not consistent with our neighboring jurisdictions or with other regulations. It's just a huge amount of water, and it's caused a lot of problems permitting wise, because there are some people that just their well doesn't produce that much that quickly. So we're lowering that to 400 gallons per day per connection.
Which is still a lot compared to the actual usage.
Yeah, it's still a lot of water, but it's consistent with our neighboring jurisdictions, and it is similar to the design for a 3-bedroom septic system. A 3-bedroom septic system is designed for 360 gallons per day. So that's that amount plus a little extra for things that don't go down the drain. So it's a much more reasonable amount, and like I said, it's consistent with what neighboring jurisdictions are requiring. And then the other substantive change is just a requirement that when someone who's connecting to a Group D water system applies, that they provide a satisfactory bacteria test. And the reason for this is because of a change that the Washington State Department of Health made to the state regulation on Group D water systems back in, I think it was 2015 or 2016, something like that. They essentially deregulated Group D water systems before they were required to do regular testing of the water system. And then in 2016, I think it was 2015 or 2016, they said, all right, county's just up to you, whatever people wanna do, we're hands off on it now. Counties can take over this or not. And unfortunately, our regulations just said that they have to be in compliance with the Group B regulations. And the Group B regulations no longer require any kind of regular monitoring or testing, so. It's not a problem for well-managed systems, but there are some systems where the well house has collapsed and the old man who used to manage the well is dead and no one's managing it anymore. There's no testing, no analysis. When things break, the neighbors kind of just wander around and look for what the problem might be, and there's lawsuits, and it's a mess. So this will at least assure that the person who's applying does have clean water for their project, whether the system is being maintained properly or not. In the future, we do hope to tackle Group Bs just in general because of the various management issues with them. But that's a enormous undertaking because there are so many Group B water systems. It would be many new staff to hire and fees to charge to do some kind of regular management and inspection of those Group Bs. So this is a minor measure that will, like I said, at least assure that they have good clean water when they're starting out with their project. So those are really the three main substantive changes. Like I said, the rest of it is just a lot of language changes and updating things to be consistent with current code and practice. And if anyone has comments or
Ian, page 5.
yes,
Under individual water sources, section 1.
you said individual water sources?
Yeah.
Yep.
You have the side comment there. The lots, parcels, tracts contained within the land segregation have been created after establishing a potable water supply meeting all state and local regulations. Are we saying though there's gonna be an absolute requirement for that in order to?
That's a current requirement. I highlighted that because that statement doesn't make a lot of sense to me.
Yeah, well, and I worry about it because I know that there's times, I'm gonna give you an example. There's a piece of property in Belfair, it's right behind the Masonic Lodge. They went ahead and subdivided a piece out that would not meet those standards in order to put it into protective covenant so that nobody can build on it. But it wouldn't meet that. And so if that would stop it from being subdivided, that'd be a problem. Because there are times like that when people take pieces like that out in order to protect it, but there may be other reasons why they take it out too, I don't know. But you could also have RV lots that wouldn't have any of that, and we've had a lot of those over the years in our county.
Yeah, under current regulations between environmental health regulations and planning's regulations, all subdivisions have to create lots that are developable.
Subdivisions or the subdividing of a parcel? Because there's a difference.
It's the same, well, any division of land has to
Yeah.
create a viable developable lot. It can't become less compliant with the regulations as far as making a developable lot. So whenever, and that's anything, if it's one parcel that just they want to chop in half.
Could that be handled through zoning? Because developable lot, for example, like I said, I know that this lot that was taken out is not developable, but it was able to be taken out, and basically they got a small amount from the federal government in order to pay for it, and now they don't have it on their tax rules anymore, and now it's protected wetlands, which is a good thing in this one. It's right, a creek goes right through the middle of it.
Did they actually change the property lines, or was it
Yes.
just a conservation
No,
easement?
they-
'Cause I know they do conservation easements.
Yeah, no, they changed property lines on this one because they called me and they made a mistake when they did it, because they lost one of their parcels.
Oh. Well, all I can say is, under Mason County's current processes right now, every lot that's created has to be either compliant or not be made less compliant. So like if there's a boundary line adjustment and the lots are already undersized, if they're shifting it around and the lots are staying essentially the same size, we're saying, okay, there's no net change, you're not making it worse, so, okay, you're not changing the status quo. But if they want to make, if they're taking 3 lots and moving things around, and then they're ending up, and they started with 2 lots that were compliant and 1 lot that wasn't, and then they're ending up with 1 lot that's compliant and 2 that are not compliant, we wouldn't allow that.
Yeah.
But if they're increasing the number of compliant lots, then that's something that would be allowed. But this particular section is for subdivisions, and this is a statement that has to be filed on the plat.
Well, if you don't mind, keep that in mind now, and remember, in my term knowledge at least, subdivisions and the dividing of land are 2 different things. The subdivision is something that's created and separated out as a for a plat, basically, of everything. That's creating of a subdivision.
Mhm.
So if it covers that, then I wouldn't expect they could create any that weren't buildable. But if it's the subdivision of a parcel, that's another question. So maybe we'll look into that, and you and I can talk about it some other
Yeah.
time.
The-
Because I wanna make sure those things are protected, so people have the ability to do that when they need to.
Mhm. Yeah, we can certainly talk to them.
Any other questions or comments on that one? All right, you got anything else?
Just, Ian, just process-wise, this is just informational today, and then this will come back in front of the Board of Health or the Board of
This is gonna go before the Board of Commissioners.
Okay.
Because right now, Kel is taking her piece out,
Gotcha.
which requires a simultaneous change. And then the requirement for 800 gallons is very burdensome on people and, that are applying, and it really needs to change sooner than later. We've been issuing waivers or variances to try to capture that process and allow people to still move forward when they're not able to produce 800 gallons. But 800 gallons is really just a crazy amount of water. And so we would like to make this change sooner than later and not wait.
I love that part of it. Just,
Great, well, we'll look forward to more discussion then. Thank
Okay.
you.
So, if there's no more questions on that one, you wanna go ahead and hit your next piece here?
Yes, so I have this, this briefing item, this was something that I typed up prior to being ill, so I was able to just shoot this over to Mackenzie. This is just an update on the abatement fund. So for those that weren't here or were unaware, in Mason County, we don't have a funding mechanism to do solid waste abatements on properties. You know, if there's a property that says, like a huge amount of garbage or trash accumulated on it. So we have our Foundation Public Health Services money, and Dave and I had discussed the possibility of creating some funding using the Foundation Public Health Services money to do abatements on properties that have huge trash accumulations. Now, one of the challenges is if you have a property that's privately owned and it's someone who's on, fixed income and they have this huge challenge on their property. Sometimes they created it, sometimes it was created by the predecessor that owned the property. They want to clean up the property, they don't have the physical ability or the financial ability to do the cleanup themselves. Those are good situations where we could use this money to do a lot of good. And one of the challenges is the way our code is currently written. If we do an abatement, we would have to, based on the reading of our county prosecutor and county treasurer, we would have to eventually, if unpaid, foreclose on the property through a tax sale. It's nothing that in general, my impression is that's not something the county is really wants to do. So we explored removing that portion from the code. This was something I've been working on for almost a year now, really. And recently, the attorney changed his recommendation to say that he does not recommend removing that portion of the regulation, and instead retain the ability to do a tax sale on those properties. I don't want to put words in Tim's mouth, so I had him, review this to make sure this was written exactly as he wanted. He said this is consistent with what his guidance says.
So, although I would agree with that, I want to remind you history. It all depends how we do it. If we do it straight as an abatement, but if we do it as something that is voluntary and we enter into an agreement, we can change how that is done. We may have to call it something different, find another way to utilize the money, but we have done that in the past here. Before I ever became a commissioner, they loaned out thousands of dollars to people that were hooking up to the sewer in order to put their piece from the sewer to their home. We were able to loan them money and put it on there, and when they didn't pay or did not pay, then we were able to still put lien on it because of that, and we were able to sell it at tax sale. But if you do it under taxes and put it on their property tax, then it has to be paid within 3 years, or then we have to put it up for sale. That's where the separation might be.
I think the problem is to approach someone and say, Mr. Johnson, would you be willing to let us do this cleanup? If there's that possibility that they're gonna lose everything if they allow us to do this cleanup, the safe bet for them is to just say, no, thank you. So that's kind of where we're
But
stuck here.
it depends, if you give them two options. One is we have a forced abatement, which would trigger all that. They go right into losing it because we have the power to do that. But if we have a chosen abatement that we allow them to, we can give them 10 years, we can give them 15.
We could choose to do that. I think the treasurer's perspective was that we had to, and there was always the possibility of them losing their house.
Well, there would be if they chose to do it. There was a possibility of them losing their house when they chose to take a loan to get the sewers. So that's all a choice thing. If you want it to be choice, we can't just give money away. We're not allowed to. But
Well, we could do these abatements without recouping costs like this. It's just the attorney's recommendation that we retain the ability to do this lien process. There's nothing that's contingent on this funding that we recoup the money ultimately through a lien or a tax sale.
But if we don't have them paying back, why would we keep a lien on it?
I'm sorry, say that again?
If we don't have them paying us back, then why would we keep a lien on
We
it?
can put there's two types of liens. There's like a mechanics lien
Yeah.
where you say, okay, when the property sells, we'll get our piece.
Yes.
There's that type of lien, and then there's this type of lien, the way our regulations are currently written, which is no matter what, it goes to tax sale.
So you're saying do it as a mechanics lien?
Yes, that was our preferred pathway, was to go that route and do it as a mechanics lien and not as one that would eventually end up as a tax sale.
Because I'm a realtor, I get all that.
Yeah, I'm certainly not an expert
Yeah,
in that,
no.
it's just,
Anybody else have any questions or comments on this one? I see you're, yeah.
Yeah, Miguel, I'm just curious, so you had an abatement in 1400 block of Railroad here last year. How did the city approach that? I know a little bit different circumstance, but certainly kind of similar to when we would wanna go in and maybe abate property.
Yeah, we had a lien, I don't know whether it was,
I read the examiner, report for that one.
we had a tax lien, but I don't know which.
Yeah, they did a tax lien, so they will end up owning that property.
Okay.
That owner was an out-of-state corporation that was like defunct or something.
Right, and so the cleaning, all the fees for the cleanup and everything also went to that lien, right?
Yeah, it was all built up and then, okay, with the same process basically. we currently have.
Do you need anything from us on this today, or can you give us some time to think this one over?
Yeah, I don't necessarily need something today. I just eventually, I would like some guidance on where the board would like to go further with this. Is this something that I should approach the county commissioners with to say that the board recommends to still remove that part of the regulation or not?
Well, it's up to the board if they want to make a motion for that. I know myself personally, I'm not ready after looking at this. I need to see some,
Yeah, I'm not necessarily all saying that we have to do
a
something
motion
today.
overcomes anything I'm thinking. So
Yeah.
does anybody want to do a motion or anything, or? Okay, so yeah, let us look it over a little bit and let's talk a little more.
Okay.
See how to do it. Just so you know, for my personal, I have no problem with having a mechanics lien. That doesn't bother me because then we get our money back. I do not like the idea of just putting the money out because then it'll become, well, you gave it to this one, why won't you give it to me? And I don't want to be in that situation. Well, they decided this one needed it more than you, but wait a minute, I'm on retirement, you can see where those troubles would come in. Actually, you recognize that's one of your first worries, actually, that you hit me with. But if it's a mechanics lien, then the money still comes back, it's just not today.
Right.
That takes away a lot of it because you're not giving away the money, you're just providing an opportunity.
Yeah, it's not free and clear. We're just saying when the property sells,
Yeah.
then we recoup the cost.
Yeah.
It's just that difference. It's either, we're getting it no matter what in 3 years versus we're getting it when it sells.
And it doesn't necessarily, that's what I'm saying, it doesn't necessarily have to be 3 years. If you were to do it in the form of a loan, it could be structured with a repayment coming back over 10 years or so, like they did with the sewer. I'm not saying that's how you do it, but I'm just telling you, we've done it in the past that way, so I know that there are possibilities of how to do that. Anything further?
Just, it's a really good thing for us to be thinking about, I know that there are properties all over the county that would, there would be a benefit to doing it, but we wanna make sure that we're not creating a new set of problems by solving one.
Yeah.
So, I appreciate the effort you're putting into it.
Well, I think one in Beards Cove that they had the same thing and they had to abate it and get rid of it. Then the person would turn around, sell it and collect all the money we just did by doing it. Instead, they had to sell it on the market. They sold it dirt cheap because the cost of cleaning it was huge. And I don't wanna just put that money, everybody else's money in that person's pocket. So, yeah, let's continue to look at that.
Right.
Do you have anything else for us?
Nope, that's all I have.
Okay. Well, thank you, Ian. Community health report.
Good afternoon. I've got my report attached to the packet. A lot of business as usual for community health. So, the invitation still stands. If there's any more, information that would be more helpful, you don't like the way the data is presented, please definitely let me know. Councilmember Gutierrez, as a newer member especially, if there's anything that you can think of that you would love to know about community health, reach out, happy to provide that. I think a really huge emphasis in the next few months especially is having this data not just be available for bi-monthly reports like this, but actually kind of in real time on like a dashboard on our website, as well as our Healthy Mason County website. So one of the biggest priorities for me over the next 2 months is I'll be meeting with our epidemiologists to kind of do some evaluations of our current programs so that we can really kind of assess, are we meeting the intended purpose of our programs? Is there anything that can be more effective? Do we need to do some improvement in our programs? As well as, we have some reports on housing and treatment sales tax, but really looking at all of our programs. So that's a huge emphasis. A lot of really good opportunities. I think you've heard us talk a lot about WIC over the last few months. You're gonna keep hearing us talk about WIC over the next few months. That's the reason why we have Rachel here, so I'll hand it off to her shortly to kind of just share where we are and some announcements about our launch date and everything like that. But I think for me, one of the most important pieces is that I've mentioned this before, it's not gonna stop at WIC. There's so many opportunities to expand into other areas where there's gaps for families that are limited resource. We are also transitioning a public health nurse that we hired during COVID to actually start bringing public health out into the community, doing more chronic disease prevention. We talked a little bit yesterday about the YMCA doing an obesity prevention program. We're looking more at what we can do for youth, because I think if you want behavior change, you have to really get them while they're young. So looking at youth, but also a population that we haven't really traditionally focused on, which is seniors. So what can we do for injury prevention there, fall prevention? We're looking and exploring, there's a lot of trainings that she's working on right now. Really reaching out to community partners to kind of figure out where can we do programs that are accessible. A lot of times the limitations are that you have to pay a membership fee, or the hours a day don't really match with a busy parent schedule. So we're really kind of exploring those kinds of things, and I think that it really fits well as an extension of WIC, referring into programs like that. So I think that's some of the types of things that you'll probably see over the next year, long term. Rachel, is there anything that you want to share about WIC? Did you bring anything or?
I brought a couple little
Okay.
things. So I brought some flyers I made that talk about our launch date. We're gonna be launching March 1st. We're gonna be open 3 days a week, Mondays, Wednesdays, and Fridays at the YMCA. I'm so excited. And from there, it's actually come together very easily and very quickly. So now we're just waiting for this date. We can't really do anything until then WIC services wise, so I'm gonna focus on outreach starting next week. I made a list of 100 different places I'm hoping to hit before we launch. Tons of community organizations, churches, schools, everything you can imagine is on this list. And I'd like to introduce myself and learn about the programs that we have here in Mason County so I can share all of that with our clients. Me and Melissa have also talked about, I'm super excited that this year we're going to participate in the Farmers Market Nutrition Program through WIC.
Cool.
So we're gonna have a table at the market in June where we're gonna give out the Farmers Market Nutrition Program benefits to our WIC families. And WIC families can get up to $86 in fresh fruits and vegetables, so that's very exciting. And they can also use their actual fruit and vegetable benefit, their regular monthly benefit at the farmer's market. So we don't know how much we're receiving for that yet, but we did find out today that yes, we will be getting that, so I'm very excited. And we're also gonna celebrate World Breastfeeding Week in August. And we're gonna plan an event at the YMCA for that, for all our breastfeeding moms, and not just our current breastfeeding moms, our past breastfeeding moms. And the WIC gives us all kinds of wonderful goodies to pass out for free.
Thank you for that. Just so you know, the reason why whenever this comes up about why I go like this a little bit is, this wasn't even on my radar until Commissioner Trask kind of put it on my radar. He may have already, I don't just know for myself. And once she put it on my radar, then I started looking at it and becoming 100% supportive of it. But it has to start somewhere, type things. And for me, that's where it started, so that's why I always do that with her. But I want to tell you something else, something strange, especially since you haven't even really started yet. I've gotten a dozen phone calls over the time of people saying thank you. So, and I literally tell them we need to thank Commissioner Trask, because I just was a boxcar hooked onto it, because literally, I'm so glad you did it, because if it's affecting, if you get 12 phone calls, you've got 120, you've got 500 people in the background that aren't calling you. So it was very, very important. So what you're doing is very important.
Thank you.
And you haven't even started yet, so I can imagine it's gonna happen once you do.
I think one thing that should be said too is 53% of all babies born in America are born on WIC. And most people don't know that.
I didn't know that, no.
Yes, 53%.
I wanted to touch on fall prevention. There used to be a program in North Mason, Jeremy Hicks used to put together a program. And they would literally sit there, because they go out and they dealt with a lot of people that were fall. They had a fall program. Maybe we need to look at partnering with them again, or he's not there anymore, but
Area
maybe.
agency,
Yeah,
yeah.
Where was it?
Area agency on aging.
Oh.
Yeah.
because it saves us tons of money, tons of hospital, tons of everything
They-
by you getting this out.
Yeah, they have it at the hub and they have it at the senior center. So,
And
reach
why?
out to them.
Yeah,
Why, sorry.
Wasn't Jeremy with the fire department?
not
He's not
anymore.
He used to be.
Yeah, he's
Isn't
up
Abe
north.
doing that work for them now?
I
Yes.
don't know.
I saw a
He's-
lot
I
of
think
stuff
so.
on, they had an announcement
I
where
don't know
Abe
if
was
you know him or
installing
not.
grab bars and stuff like
I
that.
wouldn't be surprised, because
So-
he's kind of the catch-all for all I know.
There's, I think there's that too, so.
And you already know him, so.
You all know Abe, you remember Abe,
I think Fire 4, or now, what are they called,
South Mason.
South Mason Fire? I'll never, I think they're also starting something similar to like the North Mason program is doing with community resources, so.
Well, let's pull them all together and get as much out as we can. We save so much money, time, and health by doing it early. You know, how many people have we lost because they did fall and did not recuperate from that? It's amazing how that works.
Risk prevention.
Yeah.
I think there was something, I'll have to look into it, but I think North Mason was doing like a risk prevention week, or there was some sort of
Yeah,
event or group that was starting.
Well, Jeremy had it as part of the regular business, and they had I think an Eagle Scout that made that his program, and that's kind of where some of that came from too. So actually reach out to them too. Let's get them all.
Thank you. We're in the information finding stage right now to kind of reach out and make sure we're not duplicating services, but we're expanding reach. It's figuring out what other agencies are doing, so this is very helpful. We'll definitely reach out. But we're really excited. I think, public health is definitely shifting back to what it was. Preventing, right? So that's a lot of what we'll see over the next year. And I'm glad, Commissioner Allen, that you mentioned the case of people calling. We've actually set up an internal process for streamlining calls because we know Rachel's phone's gonna be ringing off the hook. We actually broke the county phone system during COVID, when we opened vaccine clinics, so.
Well, I'm just wondering how they all know. If we're not actually even doing it, but they
The
know.
newspaper had it up.
Oh, is that what it is? Because
Yeah.
they know.
We've got great resources for getting the word out.
Because I've got a lot of calls,
The
not
state has
just
been
a couple.
intentional not to announce it yet, so that we can control appointment times and everything like that, but word travels very quickly. When Rachel was at CMAR, people were already asking about it, so we
I bet
created
Thurston's
some
spreading the word
systems.
too.
Good, we know, and that's why we're kind of already planning the next step, knowing that we're gonna expand very quickly. So what does staffing look like? We're ready to go if we need to hire another certifier right away. We're actually taking, Caesar, who is our Spanish-speaking outreach person, is already in really high demand, supporting other public health programs, but he's already kind of going through the certifier training, so we can increase his time in the WIC program until we can hire another person.
I'm trying to remember which one. There was a group that called me that, in particular, that was saying that we're so smart for doing that. And that's where I used the term where I was just a boxcar hanging on. That was actually her. I just didn't know about it. To be honest, I didn't even realize it. It was just something that existed out there. I didn't realize we had completely shifted away and it went away and everything like that.
But it was run by the Community Action Council,
Yeah,
and it got dropped in 2021
yeah,
with no notice.
with no notice.
And that's when you started talking, saying something has to be done, and here it is.
Great champion.
Yeah, great job
Yeah, it
for
was
our
a-
people.
It was a team.
And huge kudos to, you know, this would not be possible without our partnership with the Shelton Family YMCA and Mason Health for allowing us to use that space. So we're kind of hustling. Everything is still in my office right now. We will be moving it into the clinic space eventually. But we do plan to have like a very nice kind of celebration ribbon cutting event to really celebrate before March 1st. So we
When
don't
you
have
do,
to-
I'd like to make a request that you, because believe me, having a champion that starts things out gets everybody else behind him. That's how it works. You ought to ask Commissioner Trask to cut. I wouldn't mind him, neither would Kevin on the thing, so.
Absolutely. We'll definitely share the date with you once we have it. We're eager, we're ready. We actually already have flyers and invitations. We just need to put the date in there. So we'll let you know.
And we'll help you however we can to expand on it too. We like it when people like us.
And then finally, kind of, you know, I think this isn't also the last time that you'll hear about this endemic grant. We've spoken a little bit about it on a previous commissioner briefing, maybe 2 weeks ago. Just data around our current syringe exchange program. We did not get it into the actual report, but Christina did prepare a supplemental report on some of our historical trends with the syringe exchange program. And I don't know if we have enough copies to pass out now.
No, I didn't.
You can
no.
tell us too. I'm just been curious. It was Kevin that actually asked for information, make sure he gets one of these, but I've been curious ever since. What is happening? What is the,
So, should I just go for it? So I didn't actually think that I was gonna be able to hand out copies since it wasn't in the packet, but I have this electronically, or I think we might even be able to just make copies,
We can also
here
send
and
it out.
distribute. But, so it was actually a really nice time. We heard that at Board of Commissioners, there was a request for some data and some information. And January 1st or the end of December was kind of a neat 5-year program. So this is a wonderful opportunity to look at 5 years of data and see what we've accomplished. So I'll pass out the 2 copies.
I have, you know what, you can take mine as well.
But I'm just gonna briefly just go down and read through
I'll just read it real quick and I'll
some of
pass
the
it.
points, but in those 5 years, we have engaged with 749 unique individuals, so we do capture code data and we capture a lot of information at each engagement. We have had 2,236 engagements, so that's each visit that we have folks. On average, people are getting supplies for 3.7 people, which is something that we'd actually really love to reduce. You know, it's not just a transactional program. People get a lot of benefits from the, you know, engagement support and the offer for linkages to care through us. So we would really love to be more face-to-face with folks.
Isn't that part of, I'm sorry, but the actual engagement is part of the program?
100%.
Because you want to be able to talk to them and encourage them and
Yes.
offer them resources
Yeah.
and things like that, right?
And at the back, I actually got some testimonials of some folks in preparation for this. I just said, what does this program mean to you? Or, you know, how have we impacted you? So you'll see some things that I will let everyone read at their own leisure. But I do think it's interesting because a lot of people call it the syringe exchange program, but we're really just an outreach program, a community outreach program. So what I thought was really interesting when I poured through the data is that 8% of our engagements actually did not receive syringes at all. They were coming here for other services, a lot of time naloxone or wound care supplies. But a lot of people just come when they don't know where to go for help. We had this elderly woman who, her husband died and she found out that they were in a lot of debt and became homeless. I mean, she lost her husband in 50 years and didn't know what to do, and she was so embarrassed. And somebody told her to come to us, and she sat there and she cried, and we hugged her and we gave her all sorts of stuff, and she left with hope and knowing where to go. So we have exchanged just about 1 million syringes, And 19% of our individuals have received a behavioral health referral. So these are actual individuals. So I went through every single person that we have seen. So that is 19 of unique participants have gotten a referral for behavioral health. And 21% of unique individuals have received a referral to recovery supports. The vast majority of those have been medical and specifically dental. Dental is our #1 referral that people have. And I also, because I am very intimate with the data and I know the people's codes, so I can kind of see their stories, it was really fun doing this report. And there was just a story I wanted to share, because sometimes it does take a really long time for an individual to be ready to receive support or go into treatment or get help. So there was one participant, they were probably one of our very first participants. So over 5 years, they visited us 25 times. And on the 23rd visit, we gave them a referral for behavioral health. And that was in April. And we have seen them 2 times since then, shortly after, and then we have not seen them again in like 8 months. Which is, I think, just shows kind of the evolution of that. I have some demographic data. I'm not going to really share a whole lot, but as far as racial data, 72% of our participants are white, and 23 are American Indian and Alaskan Native, which is a priority population of us. So I think we're doing a really good job of engaging with that. I have some breakdown of site usage. 20% go to Belfair, 24 in Skokomish, and 55 in Camilchi. I have more to expand on that in conversation, maybe at a different point. And then we just have some risk factors, behaviors, and need. 17% of folks have experienced or know someone who experienced an overdose in the last 30 days. 54% of our visits received naloxone. It was really hard to tease apart naloxone data because we have it with some of our other outreach programs as well. But I just did a snapshot of, in 2023 alone, we, in partnership with Olympic Health and Recovery Services, distributed over 2,000 naloxone kits, and we received reports of 444 successful opioid overdose reversals. So those are our program participants who are reversing the overdose. So I think that is both a sad number and also a number of hope. Those are lives that are still here. Let's see, 56% of visits request fentanyl test strips, and about 56% of our visits receive wound care supplies. Wound care is something that I really want to put the spotlight on, which is also one of our biggest kind of spotlights in this endemic grant. A lot of folks who are using substances, but also are just living in conditions that aren't really meant for human habitation, are experiencing really awful soft tissue and bacterial infections. So we're talking about, endocarditis, sepsis, it can go to sepsis, cellulitis, abscesses, etc. These are just like skin infections. Sometimes they're small, sometimes they're pretty devastating. So we give a lot of wound care supplies out to folks. Sometimes we have a couple people who have just had these chronic ulcerative lesions. A lot of it is from poor venous retain. It's not necessarily an injection-related wound. But we give people a lot of supplies to be able to keep their wounds clean and do as much dressing change as needed. And I do want to just read one quote from our testimonial. This is one of our people who has one of those ulcerative lesions on their legs, again, that they've had for over a year. They've been working with their primary care and with the wound care providers at Mason Health, but they said they just got involved with a new wound care center, and they said the wound care nurse was impressed with us. I say us because you helped me so much about how well we took care of my wounds. It isn't infected even though I've had them for over a year. So this person has had these pretty painful, big open wounds on their lower extremities for over a year, and they are not colonized by any microbes because we've been able to keep them so clean, and they're really diligent. So I have a little bit of a blurb on the back that I will not spend the time reading today, but it's a little bit about what the goals of our program is. I know this program can be sometimes a little bit divisive, and sometimes folks only kind of see what it is on the surface level as a transactional thing, but this really says at the heart of it, our goal is just to reduce acute morbidity and mortality, which is so high with this specific population. So happy to answer any questions. We have a lot more data with different things.
Well, one of the things that was asked for was actually a graph or something showing over the last so many years what it looks like. Because we were talking about the amount and whether it's continuing to be effective. So if you could maybe put something like that together, just send it to us.
Yeah, of what data points?
Any of these, especially the needle exchange, but the benefit that we're getting. I myself, when I'm reading what you gave us, I'd like to know about all of it. Is it continuing to work for getting individuals to receive behavioral health? That was one of the big ones for myself, and then to get other programs. I knew when we started this, it wasn't just about needle exchange.
Right.
I had two things in my head. I wanted to get the needles off the street as many as I could out of my little local park and the little kids plan, and I wanted to get them into a situation where they can be asked about a service, because if you don't ask, the answer is no.
Yeah.
So with that, I'd like to see what that looks like on a graph. But I'm shocked with the different percentages. So 55% is Camilchi, then you have Skokomish. Now that doesn't surprise me. I'm just saying it's weird. But I noticed Shelton wasn't on there, and I was wondering why.
We don't have a Shelton site.
But we have plenty of county just outside of Shelton.
So this is a topic that we have talked about for a long time. I am eager to get back into Shelton or to get near Shelton. So for a little bit of history, when we first started the program in 2018, we had 4 locations. We had our Belfair site, our Skokomish site, which has moved a couple times, our Camilchi site, and then the Shelton site. Now the city of Shelton was not eager to have this type of program within city limits. And
Understandable.
so we didn't actually want to push, we wanted to just say, because it was a new thing for a lot of the leadership here, and we weren't trying to, we wanted to ease into it and see what it would be like. So we found a location right outside of Shelton city limits on where Railroad and the 101 overpasses.
Yeah.
And so there was this big empty lot there, and that was, so I actually have site-specific data, of what it was before we ended that site. So when we did have a Shelton location, we had 10% in Belfair, 25% Skokomish, 5% Camilchi, and 59% in Shelton. Now the vast majority of our participants are actually coming from Shelton, and they really want a Shelton site because we're not actually very accessible to a lot of people.
Yeah.
We're not accessible to the folks in downtown Shelton. We're not very accessible to the unhoused population in Shelton.
And you're still using the mobile?
Yeah, we're still in the RV.
So if the city would maybe consider, we all know where they're at. It'd be nice if we could set up once in a while out there, because just so you know, it wasn't, again, just for needle exchange. The idea, as you see by this, which I love those numbers, we're actually getting people to get some services and some help that will help in the long run for all of them. Plus it helps keep some of the needles off the ground. Plus it provides an opportunity for them to get help when the time comes to get off the drugs. There's a lot of, if you would consider that, and we can talk to some of the others, and maybe if they could set it up, you'd be willing to come and talk to them about some of the benefits?
Yeah, and you mentioned needle litter, and so needle litter in the community is one of our biggest issues, and that's one of my biggest pet peeves as someone who works in this program. The literature shows that when an area or a city or a location has syringe service programs available, needle litter is reduced significantly, because right now in Shelton, people don't actually have a place to dispose of their syringes safely. There's a couple businesses where they have the little boxes in the bathrooms, but that's one of the incentives of our type of program is people bring their used syringes back, and we give them all sorts of, we have like 6 different sizes of sharps containers that people can have.
What I would appreciate is if you'd actually put together that information, because when the time comes, you're gonna actually need info to get them, so.
I'd love to invite you to a study session for the city council
Yeah.
and let the new council know that this is available for the citizens of Shelton.
So we've always been a little careful, and we can,
It won't be, you don't have to be careful. If your council member brings you in and invites you in, then you just come in and bring the best information you have, and it either will or it won't. But this is your opportunity if it does happen.
Yeah.
Do we have any other comments or questions for staff regarding this issue?
Yeah, Christine, if you could just maybe talk a little bit even about how drug usage has changed, and so the effect that has on our program, how
Yeah.
people are consuming.
Yeah, so we have seen pretty significant substance using trends in Washington State, and Mason County reflects the state trends perfectly. So with the onset of fentanyl, illicit fentanyl, not prescribed fentanyl, but with the onset of illicit fentanyl in our community, which hit us in about 2020, our overdose rates skyrocketed. And we also saw a big shift in the route of administration of drug use. So people really started moving away from injection drug use to smoking their substances, which we noticed a significant decrease at our program when that happened. And I was on a call, we have monthly calls with all the SSPs, Syringe Service Program calls in the state. People are saying, what's going on? We're so slow. And we started asking people and found out that people are just really not injecting. In Tri-County, their program lost 90% of their participation, which is, on one hand, not the reduction of program, but not injecting is actually fantastic. Injection drug use is one of the most complicated ways that have significant effects on, the whole body system. But we were seeing a real challenge with engagement in our programs, which is troublesome because if they're not engaging with us about naloxone, about overdose prevention, and then also that connection to services, that linkage to care. So that has been a change. Our numbers have been reduced. There are several things that we have kind of talked about internally of how we would like to change our program. We are hoping with the Syndemic grant. So the Syndemic grant is for Syringe Service Program specifically. So it is a program for people who are using drugs or in recovery or along that behavioral health spectrum. But it does come with 5 years worth of funding if the state goes on. So we had ended our pilot funding, last in 2022, and we're kind of skating by this year. So we now do have a secured 5-year of funding, and that will allow us to do several things. But we've talked about a lot of different ideas that we can do. One of the things that we have started doing is we've started going out to the encampment along Highway 3. That first camp hosts us on every Wednesday afternoon, and that has been a really great way of engaging folks who were not engaging in our program before, which is a big priority population as well. But we are seeing, still a lot of overdoses, regardless of what that route of administration is. And everyone in the state has just been waiting for xylazine to hit us, the tranq drug, which we don't have any evidence that there is much of a real prevalence in Washington State, although it is here, it comes in pockets. We just started distributing xylazine test strips, so people can actually test their substances for that, so we can get some more real-time information. But that's something that we're kind of bracing ourselves for. Maybe the impact won't be that severe, but it could be a real challenge.
Let's hope not. But we adapt or we die. We have to move through the programs as we need it, especially if we're going to get back into new territory. It should be nice to have more things to offer. Any other
I
questions?
just have one more.
Yeah,
So
please.
when you go out to the encampment, do you coordinate with the host team from Olympic Health and Recovery, or is this,
No, they go a different day.
okay?
So they come out on Tuesdays and Thursdays, and we have our fixed sites on Tuesdays and Thursdays. We're actually going out with the RCorp, so my outreach partner, which is paid through RCorp. So we are going out with Olympic Health and Recovery Services. But the RCorp case management program is a little bit unique. There's 2 avenues to get into that program. It's either through the jail or through Syringe Service Program. So right now, we are just doing that through that program, but we are, giving referrals. The host goes to that same camp on a different day.
Great.
Thank you.
Yeah, when I went, sorry,
No, please.
when I took a little walk out there with the sheriff and some other people, and they've got some very friendly cats at that encampment.
Oh, yes, all the Siamese.
Oh my gosh, they're so
Yeah.
cute. But we did notice a lot of needles along the way. And so it makes sense now that you're saying, that you've explained how this works also. But you mentioned dental. Where do they go for dental?
So I refer people to 2 places. One is Peninsula Community Health Services in Belfair. And then the other place is Olympic denture and dental, because their dentures take state insurance, and we've heard really great things from
Where are they
them.
located?
They're in Olympia, but PCHS is where I give like
They're awesome.
100% of
seven
my
chairs in
medical and
Belfast.
dental.
Can you imagine that?
Yeah.
I have a dream that they would bring their mobile dental clinic down to Mason County and partner with us.
Well, let's talk, I meet with them once more.
Yeah,
Yeah.
I
Yeah.
talked to them about that too.
Right now, their dental, their mobile dental does not come down here, just their medical comes down. But I think that would be great,
And staffing.
Yeah, wonderful people, though, wonderful organization.
yeah.
Anything else? All right, thank you very much.
Mhm.
All right, next up is other business, board discussion. Is any other business anybody wants to talk about? Any board discussion that anybody has?
Are we ready for the pit count? Or
Oh, yeah.
Yeah.
Point in time coming up on Friday.
Yeah.
And on Saturdays, Blue Zones kick off at the senior center.
Yeah, a couple big events.
Yeah. Pretty interesting
Melissa,
stuff on that.
how are we coordinating on point in time?
Point time count, so there's two lead agencies, which is Crossroads Housing and Youth Connections. So they've conducted trainings with all of the volunteers and all of the different agencies that are coordinating. I know there's a street outreach team. I think last year was the first year that we really actually deployed teams out in the encampments and increased our number, but the same thing is going on this year. There's gonna be pop-up events, resource fairs going on downtown Shelton, 2nd Street, outside Youth Connections, as well as in Belfair, on Friday, and I believe both events are from 10 a.m. to 2 p.m.
Out of all the years, finally this year, somebody actually asked me, Randy, do you know where some of these are out there that we don't know about? It's about time somebody asked that question, but yeah, there's quite a few out there in Belfair and the different areas in the woods, go to the Union River, both sides. But yeah, just asking, you find out that we all have a little bit of knowledge and we're willing to share it with you. Any other board comments or discussion?
just a comment?
Yeah, please.
Thank you for welcoming me to the table, and Randy knows we've had a lot of long discussions about a lot of my health issues and how I've made a little bit of a comeback, and now how that's kind of guiding my life, and I'm really happy to be on this board and to serve on this board, and to make sure that we're good caretakers of the community, so thank you for having me.
And you, from what I understand, you volunteered to come and do this one. And so I very much appreciate that. We appreciate you coming and joining and being a part of this. We look forward to working with you. Anything else? Hearing none, next up we have public comment.
Yeah, I do.
Yes, please.
So, this came across in my emails, and so it prompted me to ask, do we know whether we are testing the wastewater in, I guess it would be the North Mason, in the Belfair wastewater treatment plant, or?
Testing it in what manner? Because they test it for all kinds of
diseases, I'm sorry, yeah.
So I think right now the city of Shelton's the one we've got.
It's testing for the.
So it interests me, so actually it was interesting because it was the biosolids department that sent this to me. So it has a very short time to get the grant, but it is for invitation to rural, small, territorial, tribal utilities to apply and receive a free automatic sampler and flow meter package.
If you will leave us a copy of that, we will make sure to get it
So
to
this
us.
is you, I put
Yeah.
BOH,
Yeah,
Public
please,
Works.
please make a copy. We'll get it to both staffs from the city and the county.
Because I think that, so the one from Shelton is helpful, but it would be interesting to get
Yeah.
the North. Okay, thank you.
Oh, you're very welcome. Is there any
Thank
other
you.
public, anybody else that'd like to speak? Hearing none, our next meeting will be when? Do we have that set up yet, or will be,
It's on the calendar,
2 months from now.
yeah.
2 months.
it'll be 2 months from now?
Right.
Okay.
26.
March 26th, okay. All right, hearing that, if there's no further action, I'll entertain a motion.
So moved.
Second.
It's been moved and seconded, we adjourn. All in favor signify by saying aye.
Aye.
Any opposed? We are adjourned.
Okay.
Thanks, everybody.
Thank you.